Hello, I'm Dr. Craig Childress. I'm a clinical psychologist in Pasadena, California, and I specialize in working with children and families around issues of attention deficit hyperactivity disorder, parent-child relationship problems, angry, oppositional, defiant children, marital problems, things like that. Now, in this video series, I've been discussing a particular type of parent-child relationship issue that I refer to as a parental alienation dynamic. And in this video segment, I'm going to be discussing the treatment context necessary to address the child's primary DSM-4-TR diagnosis of the shared psychotic disorder, or the shared delusional disorder. Now, the delusion itself involves the transgenerational transmission of trauma, whereby early childhood relationship patterns of the alienating beta parent are being transferred and imposed upon and reenacted in current family relationships. And the shared delusional component of the shared delusional disorder involves the child's participation in that reenactment narrative, whereby they are playing a role within relationship patterns from 20, 30 years ago. And in that process, they are losing the authenticity of their own childhood and the authenticity of their own relationships during childhood, such as the relationship with the Delta parent. Now, the shared psychotic component of the shared psychotic disorder involves the hyperactivation of a particular relationship system called intersubjectivity, what Ed Tronick calls a dyadic state of consciousness, and it is the hyperactivation of this relationship system that's mediated by an underlying set of brain cells called mirror neurons, whereby we feel what other people feel as if we were having the experience ourselves. And with the hyperactivation of this system, the child has lost the ability to differentiate their own authentic experience from the imported experience of the other, of the alienating beta parent. And so the child is experiencing the inner psychological meaning construction and inner psychological state of the alienating beta parent, not as if it was the child, but that it is the child's authentic experience. The child authentically believes that that imported psychological experience is authentic to the child. This would be analogous to our going into a movie theater where we activate our mirror neuron network and feel what the actors feel as if it was our own experience. But instead of maintaining a differentiation between the experience of the actors and our own authentic experience, if we lost that differentiation and actually began to believe that the actor's experience was authentic to our own personal experience, that would represent a psychotic state. And that's what's occurring within the alienation dynamic, is the child is attributing the imported experience via the mirror neurons and the intersubjective system, is experiencing that imported psychological state as authentically being the child's state. And in that fused psychological state where the child is attributing their own personal authenticity to the imported psychological state from another, that's how the child is importing and the psychopathology of the alienating beta parent. The narcissistic self-inflation, the narcissistic sense of entitlement, the narcissistic rage, the narcissistic loss of empathy, the borderline splitting process, the paranoid persecutory features. All of that psychopathology is being transferred to the child, and the child is attributing authenticity to that experience, that it belongs to the child, not that it belongs to the alienating beta parent. Now, in order to successfully treat and address the shared delusional component and the shared psychotic component of this disorder, it will become necessary to psychologically separate the child from the source origin of the delusion and from the source origin of the hyperactivated intersubjective state. Okay? Which means that it will become necessary to separate the child from the beta parent. Now, when we do this, when we separate the child from the beta parent, we are going to activate all sorts of psychopathology with the beta parent. In particular, we're going to reactivate three areas of psychopathology. The first is the trauma networks. that when the delta parent separated, psychologically separated from the beta parent, they reactivated the trauma networks out of early childhood having to do with psychological separation, represent danger. And so they reactivated all these anxiety networks. And the beta parent then experienced this intensive, overwhelming anxiety and attributed meaning to the experience of the anxiety, that the delta parent was somehow dangerous because they were associated with this anxiety. And so the delta parent was somehow dangerous, they must be abusive. So from the perspective of the beta parent, they authentically believe that the delta parent is abusive because they experience this anxiety. They know it for a fact that the delta parent is abusive because this anxiety is real, it's authentic. In addition, when that trauma network was reactivated, all of the representational networks for all the characters within the relationships were also reactivated. So the alpha parent and the beta child were also reactivated as part of the trauma network. And with the reactivation of the representational networks for the alpha parent, there was an overlay with the representational networks for the delta parent. The abusive alpha parent, the abusive delta parent became equivalent. In addition, the activated networks for the victimized beta child became overlaid and equivalent to the activated networks for the victimized delta child. And so there was this fusion of representational networks. So when we return the delta child to the abusive delta parent, we are, in addition, returning the beta child to the abusive alpha parent. And so we are reactivating all of the trauma networks associated with the beta parent's own trauma history. And so that beta parent is going to activate with a fury and a focus in trying to rescue the child from this abusive relationship. In addition, we are going to activate all of the borderline personality disorder processes having to do with fear of abandonment. And currently that fear of abandonment is being managed through being split and projected, so that that abandonment fear is being projected entirely over the delta parent. It is the delta parent who is being completely abandoned by the child. Meanwhile, the beta parent is the never to be abandoned parent. And so the child is serving to split and project the abandonment fear of the beta parent, allowing the beta parent to manage that anxiety associated with a fear of abandonment. But when we return the child to the relationship with the delta parent, we are abandoning the beta parent. The beta parent will be the abandoned parent, while the delta parent is the not abandoned parent. So we are going to activate all of the borderline processes associated with fear of abandonment. In addition, the beta parent maintains the representation, the projection of the all-good parent, the split representation of the all-good parent out of the early childhood relationship processes, while the delta parent maintains or has the representation, the projection of the all-bad parent. Now, the all-good parent is the protector of the beta child. Okay? It protects the beta child from the all-bad parent. And so when we return the delta child to the delta parent, the beta child to the alpha parent, we are reactivating the protective role of the all-good parent, the beta parent, that it becomes essential for them to protect the child from the abuse of the alpha parent. Okay? So when we reactivate, or when we separate the child, we're going to be reactivating all of these psychopathological networks for the beta parent.